What is going on, guys? Thanks for tuning in to yet another video. My name is Anthony Pinto da Costa and you are watching the Canadian Physio Student. Alright people, so this is the first of many video interviews that I will be putting on this channel. During these interviews, I'm going to be sitting down with some clinicians to discuss certain topics in physiotherapy in hopes of providing you guys with some clinical pearls that you can take with you and then subsequently apply them within your own practice. With that said, the topic of the day for this video is discussing the use, application, and importance of soft skills in physiotherapy practice, which I'll be discussing with Will Carlson. Will, how's it going today?
Good, man.
Good. So, I'll first start with just how me and Will know each other. So, Will was our professor in first year for a number of our classes. Felt like every class we walked into, we just saw this guy. So it was good to have him around though. He taught us our professional practice course, half of it. He taught us our foundational clinical skills course. And then he was also an academic assistant in both our spinal disorders course and our muscle and joint function course. So he's been around and he's a great educator and we love to have him around. So I guess I'll give you the floor now just to introduce yourself, tell people who you are, where you're from, education level, teaching experience, all that.
Cool. So I started with my BSc in kinesiology from UWO. Ended up graduating my MSc PT at Queen's in 2015. And just kind of grew some roots in this city. It was an awesome place to pick up shop and kind of get my career going, and it felt really natural to start up here. So in my first couple of years after graduating, I tended to balance growing clinically as well as growing as an educator as well, whether that was, like Anthony said, picking up contracts here or there with the school, whether that was in a term adjunct position or whether that was in an academic assistant position. I kind of bounced back from a lot of different lives, whether that was in clinic or whether that was bouncing around here at Queen's. So it was a busy startup. I would say now more or less I've transitioned more into the private practice aspect of my profession, where I've come on as a partner with a clinician in town here, and we've opened up two clinics, JD Physiotherapy Central and East, which has tilted the levels more for myself away from the school into that practice. But I still hold on to this very close. It's close to my heart, and just like Anthony said, it's great to come back and do things like this. I think the initiatives are awesome. I'm seeing more and more around the area, and I think it's good for us to connect as clinicians as well as colleagues, future coworkers, and friends. It's always nice to bounce some ideas around. So kudos to start this up. This is cool.
Yeah, thanks for that. So I guess we can get right into the nitty gritty of the actual topic, and I guess I'll just open up by asking you, what are soft skills and why are they important to have as physiotherapists?
Sure. So soft skills are, I guess I'm going to come out and say it. I mean, they're everything in our profession, and I almost feel like the term soft skills is a little bit of a misnomer, and it almost doesn't do it justice, because in this industry, what we provide in terms of within our scope of practice as healthcare professionals, none of it matters if we don't have that relationship with our patients, with our clients, with our coworkers, with authorities in the industry, or really anyone who we're involved with. So we'll kind of see soft skills bounce around different synonyms, and I've seen it in the evaluation criteria for physio students as communication skills and maybe professionalism. We see it more in clinical practice as strategies to developing therapeutic alliance or developing that therapeutic relationship. So at its essence, it's really the ability to make that relationship with our patients and make it fast enough and make it strong enough that they feel that they can give us the trust or have the trust in our skills to move forward with it and help them in their rehab. So soft skills, what is it? I mean, there it is. So it's really just being able to meet people, connect with people, and develop that relationship.
Definitely. So yeah, and I think like learning it in class, when we learned it in the foundational clinical skills course, obviously knew it was important because we were learning it. It's in the lecture slides, you gotta know it. But when you're learning about communication skills in class, you're kind of just like, okay, I know that stuff. But then when you get into the clinic and you start going on placement, you have so many other things in your head, like how am I going to diagnose this person? What's the cause of their dysfunction? What exercise am I going to give them? And you start to lose some of those soft skills because your mind is more geared towards all that knowledge and application stuff. So that's when it became apparent to me, like when they were.
That's great you bring that up, because I remember that same battle a little bit internally as a student, and this next is really relevant to students, I think, because oh man, you guys are inundated with all this new clinical skill and all this technical skill, right? And when you're practicing for your OSCEs, you're following this rigorous set of obtaining consent, moving forward into your designated skill, closing up the station, and kind of rest, rinse, and repeat. And then when you bring that into placement, that's all good because those skills are very, very important, and we must obtain consent. We must, perform professionally and competently in the room there. But I find an element of that is, certainly the kind of the soft skills, so to speak, or the relationship building takes a step back, as so does your personality as a therapist can take a step back too, right? As we're trying to achieve all of this technical and competent skill. So myself, when I was a student going through this, I identified that, and it's a challenge, right, to kind of balance, showing some personality and making those connections, as well as just trying to wrap your head around the technical skill of being a physiotherapy student, and soon for you guys, new grad physiotherapists.
So would you say like it was when you were kind of navigating through placements, that's when it became apparent to you how important they are to have?
I had an inherent interest in it, even going into my first placement there, my PT 881. It's always, again, people will identify the strengths in their practice, and I always thought that was something that kind of came naturally to me. And I think it came more and more relevant the more you start tying, your clinical outcomes and the patients who like the care that you're providing is really tightly associated with how you treat them as a person and how they connect with you, not only as a therapist, but as trusting somebody that's going to help them through this journey here. So it's one of those interesting things where as you're beginning to meet your client or your patient, and as you're beginning to perform clinically in any scenario, I mean, it's really important to make that relationship quick and make that relationship strong, because what you'll notice is people are attending physiotherapy for potentially different reasons than what we may be thinking before we meet them. And what I mean by that is, for example, I think a misnomer is maybe everyone's coming to physiotherapy to help them with their pain, okay, or maybe help them with something nagging that's not necessarily going away. And the key to developing these soft skills, and the key to really making this relationship, is maybe getting the intrinsic motivation of why that person might be there versus extrinsically what we're assuming. And what I mean by that is maybe that person, maybe their chief complaint not necessarily is pain, it's they're worried that they're not going to be able to stay mobile in their retirement, or maybe that person who is not necessarily that nagging discomfort in their neck that's giving them worry. Maybe they're worried that they're not going to be able to play baseball with their friends in the summer, and that's that kind of intrinsic motivation that I think is really driving people into our care. And I think if we don't identify that, utilizing some of the soft skills that I think we're going to get into later, I think you're going to miss out on really the whole point of what we're trying to achieve here as healthcare professionals. So
definitely, yeah, those are some good points. Like, I never really thought about the intrinsic motivation part of it.
Yeah, and that's something as well that I think the only way you're going to understand really why our folks are coming to physiotherapy is making that relationship, understanding the contextual features of why they're there to see you, and utilizing that knowledge to help them achieve their goals. So whether that's in that short-term goal setting, whether that's in the conversations that you have with that person, you're not technically going to get that knowledge from a technical subjective or a technical objective assessment. You're really going to have to get to know your folks and develop those relationships that allow you to understand some of those motivators to physiotherapy.
For sure. All really good points. So now that we know how important they are, one question I have just for the viewers, what advice would you give to both future and current physiotherapy students watching right now on how to develop these soft skills?
Yeah, so sometimes coming back to the basics of human communication is kind of the way to start with that. So if we kind of put the pen and paper aside in the assessment, and if we kind of put all the things going through our minds, so to speak, before we even get into the assessment room, almost address that as an encounter that you would have with somebody that you just want to meet and you don't want to know. So what that means is asking those questions as simple as how was your weekend, okay? Or how's your day going today? Or do you have any plans later today? All of these global questions help you identify really what's going on in this person's life and maybe what makes them tick. So for example, if I have somebody coming in to practice, honestly the first 5 or 10 minutes, my subjective, I don't have any care in the world other than just trying to get to know this person, making sure they feel comfortable sitting beside me in this assessment and kind of getting an idea of where they are. So questions kind of beget more questions. So for example, if you ask somebody, how is your day going today? They may say something like, oh, work was really busy, just barely got here on time, I'm kind of out of breath. And then you say, oh, okay, how is work? What do you do for work? Or, and then from there, you get more and more information, so much more. And then, how was your weekend, for example? And I apologize if this seems like really too basic, but honestly, these skills are what I work with. It's not rocket science.
Yeah.
How was your weekend? Like, I was playing baseball with some friends, and my aunt and uncle came down from so you like baseball? So your family's in the area. Are you from Kingston? Making these connections and gathering this kind of accumulation of knowledge with your folks. And you get to a point where with every person that you're working with, you kind of identify some major things that kind of help you understand those intrinsic motivators. So like I was alluding to earlier, that person, maybe they like to play baseball in their spare time. Maybe they've got family outside of Kingston, so they're always on the road. Maybe they've got a kid who is busy at school. Maybe they've got a work-life balance that's very hectic, so they're always on the go. These are the things that when you come back and see them for a follow-up, for the first follow-up, for the second follow-up, and you ask about these things, it really helps develop that connection, because this person on their end, their perceived value is, hey, this person really cares about, this person gets me. That's going to be the conversation that they're going to have. And I can guarantee you that's going to be a big, big driver when you're prescribing these exercises, or you're prescribing treatment, or you're doing these treatment interventions. It's going to be a huge driver, because this person is going to really feel like you get what's bringing them in there, you care for them, and you kind of have this understanding of what their life is, more or less than just, for example, elbow range of motion is restricted, this person's got pain, that's that. You know what I mean?
Yeah.
So
100%.
it's having this big contextual knowledge, and again, I know it seems really basic, but that's honestly what I do. I really just ask these questions, identify these features of the relationship, and I use those features to follow up with in the future. And as a physiotherapist, I think the important piece is, we're in that position where we have to be the leader in that relationship, in the sense that we're asking the questions, we're kind of going out of our comfort zone to start the conversation and make sure that we're driving that. Because honestly, the more information we get, and by the way, I chart that stuff. I have some of my traditional SOAP stuff. I have the contextual, and I have the technical related to my assessment, but I also chart. Person is, or client is going on vacation in 2 weeks. Client has a wedding that they're planning. Client has 2 dogs at home. So some of those things, and whether or not, mostly I'll be able to remember it, but it's these kind of things that help you follow up and drive that relationship going forward.
Definitely, yeah. Yeah, I really like that point about when the patient comes in for a follow-up, you can maybe ask how was baseball the other day?
Yeah.
Because I found that when I was on placement, if I asked these types of questions to those patients, they'd be like, oh wow, this guy actually listened to me, and they're more likely to adhere, and I found that they were more likely to get better when you just showed that type of care for them.
Totally. And we have an interesting profession. I think as students and even as clinicians, we have to realize that there's a lot of folks who come to us and they have no idea what physiotherapists do, right?
Mm-hmm.
So in the sense that if they go into a massage therapist, they're anticipating a massage. If they go to a chiropractor, they're anticipating a joint manipulation of some kind. If they go into their personal trainer, they're anticipating perhaps, a good workout session. But if they're going to see their physiotherapist, I honestly think that there's a little bit of discomfort in the room because they don't really know what to expect. And I think being able to develop that relationship, showing them that we get it and we care about them and we care about a lot of the intrinsic stuff as well as some of the contextual factors, it's a really good way to help them, like you said, buy into what we provide, which is quite a bit in terms of our scope of knowledge and scope of practice. So all of that falls short if we don't make that relationship off the bat there. And that's not just anecdotal from me. I mean, there's a lot of neat research coming out now where the outcome of your whole plan of care is almost solely dependent on whether or not that patient likes you, right? So if we spent half as much time caring about strategizing and driving that relationship versus taking all of these courses on different techniques, which I'm not knocking, by the way, because they're really fascinating what we can do now with the human body. But I think if we spent just half as much time caring about making that relationship and having conversations like this, and like, what cool strategy did you use to make that relationship right? Because this is me, this is what I do. But it's a kind of the question upon question strategy. There's other ways to do it. I just like really getting a good idea of what the person does, and I guess communication wise, right? Like having that open posture, making them feel comfortable. I mean, if we don't achieve that, it doesn't matter if you're showing them the best exercise known to our profession or doing a manipulation that took years to learn. We have to really focus on making that relationship because, again, the science tells us, as well as our experience as physiotherapists, none of it matters unless you achieve that to begin with. So
this is all good. I'm just absorbing all this knowledge here, guys. He's dropping some knowledge bombs. So before we end the video here, I just got one more thing to ask. So apart from soft skills, do you have just any other general advice that you give to future students who want to pursue physiotherapy in this day and age?
Sure, that's an awesome question because I know there's so many things on new grads' minds and new physiotherapists and students going through, right? How to position yourself to kind of drive that career that you want and you deserve to have. You guys really work hard to get this way. So when you asked me that question, I actually kind of sat down and I was like, what are some good ideas or things that I think I've maybe made the mistakes or I've gone through the last couple of years that I thought have really driven my career and brought me to a spot where I'm quite happy. And I'll kind of lay it out. Let's kind of look at it as like the strategies of, I think, successful new grads, kind of whether it's a mindset or it's things to do, because I don't think it's black or white, but I think there's some mindsets to have that can maybe help drive you in a direction that you find success. So for a lot of you guys, I think you guys in second year right now are at a position where this is going to happen soon, and I know the first year is going through this. I mean, you guys are very much just so getting the ball rolling here, but as second year, as senior level students, you really have to identify that moment when you guys are no longer students and you're going to start subscribing to the real world, which comes at you real quick. I mean, it's kind of a shocker, right? And what I mean by that is some of the rules of academia are, you really value yourself on the kind of mark that you get. You really value yourself on deadlines. It follows this kind of strategic pattern of, you study for a little bit, you perform, you get graded, you go on placement. You know what? Where it is right now for you guys are just about to embark on this new journey where none of that stuff matters anymore. And the things that really are going to start driving your profession and driving your career are I can guarantee you, are not the 95 versus the 80. It's going to start being, do you have that work ethic and do you have that charisma to start networking, to start positioning yourself, to start making those connections with authorities in the profession or mentors or folks that you think are going to be important for you or things that you think are going to be important for you once you get out. Okay, and I think in years prior, I've started talking to the senior students and I said, even though you're on placement right now, I mean, life's going to come at you really quick. Now is a really good time to start identifying that network, meeting those folks that you think are going to be very important to you, or you drive lots of motivation or knowledge from, making your brand as a person, your brand as a therapist, transitioning from a student and making that jump into the real world. Because the real world, it's not necessarily fair, right? It's going to be who's kind of there first, who is making those connections, who's making those moves. Mm-hmm. It's not going to be the person who has the highest mark anymore. It's going to be the person who has kind of positioned themselves appropriately to make the moves that they want to do. Okay, so that was kind of two things at once there. I wanted to make you guys sure that identify the strength of networking, and networking is not this big fascinating or this big unknown skill. Networking is as simple as this. I mean, we're hanging out, we're connecting. Networking is as simple as emailing a prof, or cold calling a clinic, or talking to somebody who you value as an authority in the profession or so, and just making that connection. There's no kind of steadfast way to do it other than just kind of getting your face out there, getting your face out of the books, and start meeting these people who honestly are probably going to assist you and help you in ways that you never knew possible. Because a little bit of it is, you don't know what you don't know yet, for sure. That's, you guys are just starting out, and even that other, the kind of the conscious incompetent, you know what you don't know. So in that instance, get out there and start knowing more and start meeting more people, because the strength of networking, honestly, when it comes to applying for a job or applying for a position or making those moves, you're always, I can guarantee this, always going to have the advantage if you know that person, even kind of putting a face to a name before you start applying for jobs or making resumes or taking those steps there. Okay?
Knowing the face is better than just seeing the resume.
Oh my goodness,
on the desk.
So true. So yeah, networking there, and this is a good, just kudos to you even on this. You're going to start meeting some folks in this position, and then everyone watching this video, you're going to start seeing the network of physios and authorities and folks in practice here who are going to give value to your career and give value to where you want to come. So. Definitely. I'm going to say number 3 here, have realistic expectations on your first year of work there, and have realistic expectation of where you want to go. And for this, I'm going to tie this into kind of 2 points here. So what I mean by this is, when you start working, when you start getting out into the profession, have a really good understanding of, what contracts are, what expectations of new grad physiotherapists are, what life is like as a new grad physio, because I can guarantee you it's not all rainbows and money bags coming in right away. Okay, it's there's essentially, you have to identify that even though you've been at school now for way too long, probably 6 years, you really are starting at ground zero once you get out there. Okay, and unfortunately, the reality of it for many practicing clinicians out there and folks who have been in the industry for 20, 30 years is that even though we've been at school for so long, you still start starting at ground zero, and you have to work your way up there. So there is a condition of whether or not you walk into that dream job or that dream position right off the bat there. Is that realistic or is that not realistic? And how do I get to that position? Well, there's probably going to be a lot of hard work in front of you, but the value will come and the success will come. But the realistic expectation of starting out there, there's kind of that sweat equity stage of your career, and we've talked about other people in the profession there, and there's kind of this era of hustling a little bit and getting your name out there and grinding a little bit. But I think that phase of work there where you do that hard work and you do that grind, so to speak, will pay dividends for you later on. Okay, so and that ties really well into my next point here is be opportunity oriented when you start out. Don't necessarily be career oriented, okay, or fixated on compensation oriented. And what I mean by this is I can use myself as an example here and kind of drive from a bit of experience. When you start work there, always be in search of opportunity, and whether that means taking a risk and, for like myself, putting a resume into Queens. Okay, I was pretty young as a new grad. I was like, oh my goodness, let's just see if this opportunity arises, and it did. Okay, so I got to balance a really cool start of my career where I was as a clinician at a clinic that I really respected, and I got to kind of to work in the field of academia and work as an educator. Again, another opportunity came up a few years later in my career. I thought it was way above my head. I'm like, no way I'll get hired for this.
Yeah.
I threw my resume in there. Again, lo and behold, I got that position. I was like, wow, I wasn't expecting that. Throughout my career growing up here, I would kind of just hop on opportunities, and whether opportunities were taking a course, whether opportunities were meeting somebody, whether opportunities were taking a job where it was a lot of hard work at a very low rate of pay, whether I was going on conferences and meeting people, I knew that these opportunities would give me huge value later on, if not right in the moment, right? Because opportunity begets more opportunity. It's a snowballing effect. You start hopping on these things, you start working hard, going back to my point there of, you're hustling, you're not necessarily oriented on what kind of money I'm bringing in right now, but you're more oriented in, wow, I'm going to go to this, I'm going to take that position because that's really going to help me learn in this position, or that sounds like a really cool opportunity. I'm going to meet some neat people, I'm going to network. That may give me some value that I don't know yet, but once I'm in there, that might open some doors, okay? And the way my career bounced back and forth, even starting out here at the 4 or 5 year mark, is I kind of just bounced back and forth and took every opportunity I get, and truly where I am right now, it was not linear, and I don't recommend that anyone take a linear route. I kind of just hopped onto those opportunities as they came, and I didn't really know what I was doing, to be honest, at the time, but I knew that these opportunities would drive value for me later, and they have. It's really been a really exciting couple of years of practice for me, and I really give that advice to new grads too, because to get your face out there into all kinds of different areas and to hop on these different opportunities and challenges will bring much value for you.
And take some risks.
And take some risks, take some risks. And my last one there, man, take care of yourself as clinicians, because as a finishing thought here, we work in a sector where people may be unloading some negativity on you, right? As clients or patients, work might get hard. You may be working some hard hours starting out. You may be getting exhausted. And there's a lot of really amazing authorities in our profession right now that talk about burnout, that talk about compassion fatigue, and these are all real things that can happen, especially at an early age, as you hop out of school and you look at your bank account and you're like, oh my goodness. And you look at all these opportunities and you try to get out there and you start working your tail off, right? And even myself, there'll be a couple of days where you start stacking up 12-hour days back to back to back to back, and I love it. I love that work ethic piece of it, okay? And I think we have to be prepared for that as new grads, right? We have to kind of have that realistic expectation that life is going to be hard. We work in hard professions. If it's private, if it's in the private sector, you're going very fast. If you're in the hospital, in the public sector, if you're in public practice, you're talking to a lot of different professions. It's high stress. Work is difficult. Work is amazing because you've worked so hard to be here. But take care of yourself. Understand if you start feeling those features of burnout, if you start coming home too late all the time, do that stuff that brings happiness to you, right? Or taking time off and relaxing and doing what makes you happy. Do it because as a final point here, I know I talked about the hustle probably too much and it's hard, but you want to have some fun while you're at it. So take care of yourself, okay?
Definitely.
So yeah,
loved all of that. Loved
cool.
all of that. So. Yeah, I guess that's basically all the time we got for now. Guys, just write all these points down, take them with you, because they're honestly going to add so much value when you finally get out there. I'll try and summarize them all, try and put them all in the description for you guys so you can take them as you want. But yeah, just really appreciate having you on today.
Thanks, man. That was great.
So guys, if you like this video, make sure to like, share, of course, smash that subscribe button. And stay tuned for more interviews as I have more clinicians on. See you guys later.
Yeah, another day, another dollar to be made. I'm a workaholic, ballin' hard until the grave. Used to wanna be a baller for the NBA, till the fellas around me started dunking in the 7th grade.